Hi, it's Satoru from Acupuncture Nerves. In this video, I'm going to be sharing some tips with you on how to improve one of the most frustrating symptoms of a Bell's palsy, not being able to close your eyes and blink. So I have been treating many Bell's palsy patients in my acupuncture clinic and have noticed that some of them struggle to close their affected eye or blink. Although most patients find relief from my home remedy techniques involving a facial roller, some moderate to severe cases may not improve within a month or may experience a slower recovery. To address this, I have created another home remedy techniques that you can use to stimulate blood circulation and improve the ability to close your eyes and speed up the recovery from Bell's palsy. It's important to take care of these symptoms as the inability to close your eyes can lead to blurry vision, watery eyes, and even permanent eye damage. So what is a Bell's palsy? Bell's palsy is a condition that causes sudden weakness or paralysis in the muscles on one side of your face. These conditions occurs due to the inflammation or compression of your facial nerve, which controls the movement of muscles responsible for facial expressions, including closing your eyes, blinking, and tearing. The exact cause of Bell's palsy is still unknown, but it is believed to be related to viral infections such as herpes simplex virus or varicella zoster virus. The symptoms of Bell's palsy typically appear suddenly and can range from mild to severe. If you suspect you have Bell's palsy, it's important to seek medical attention as soon as possible to rule out a stroke or other disease causes facial paralysis like Ramsay-Hunt disease. What are the Bell's palsy symptoms? Bell's palsy is a condition that causes sudden weakness or paralysis in muscles on one side of your face. This can lead to drooping your eyelid or corner of your mouth, difficulty smiling or closing your eye. Other symptoms may include pain or discomfort around the jaw or behind your ear, headaches, sensitivity to sound in one ear, or changes in taste. So how to scale Bell's palsy? After you go to the ER, you find out that you have a Bell's palsy. You might wonder if you have a severe or mild. You can check out my other video, how to scale Bell's palsy, to see if you have a severe or mild Bell's palsy. When you are unable to close your eye, you can start adding these techniques to speed up the recovery process. Self-massage for your eye. As I mentioned earlier, Bell's palsy is involved by the seventh cranial nerve called facial nerve. The facial nerve branches out in 5 different ways, and the first and second branches called the temporal and zygomatic branches control your eye closure. You need to massage 12 points using your finger or thumb. These points are based on the meridian and channel from traditional Oriental medicine, which licensed acupuncture used to treat Bell's palsy. First point. To locate the first point, put your finger between the inner eyebrow and the inner corner of your eye. You should feel the slight depression of the bone. This point is very close to the acupuncture point called UB1 or seimei in Japanese. Use your thumb or fingers to press down towards the nose as if you were trying to force your eye to close. Repeat this motion 10 times. Second point. To locate the second point, place your finger at the supraorbital ridge, which is just below your eyebrow. The ridge will feel like depression in the bone. This area is the pathway of the supratrochlear artery and nerve, which nourish the orbicularis oculi, frontalis, and corrugator muscles that help you to close your eyes. To massage this point, use your thumb and press towards the bone in circular motion. You may feel some soreness or tenderness, but it's normal as long as it's tolerable. Repeat this circular motion 10 times. The third point is located next to the second point on the outer side of the orbital bone. This point located the lacrimal gland, which is responsible for controlling your tears. To massage this point, gently press against the bone and move your fingers in circular motion 10 times. Fourth point, The fourth point is located at the inner corner of your eyebrow. When you press down gently with your finger, you will feel the slight indentation called the frontal notch. This area is where the supratrochlear artery passes through, providing a blood flow to both forehead and upper eyelid. This spot is also happen to be the same location as that acupuncture point known as UB1 or Sanchiku in Japanese. This point is believed to be beneficial for eye health. To stimulate this point, massaging in a circular motion 10 times. The fifth point. To locate the fifth point, start from the middle of your eyebrow and follow it with your finger. You will feel the depression known as a supraorbital notch, which supply the blood to the levator palpebral muscles that control your upper eyelid and eye closure. This point is close to the extra acupuncture point called Yuyao or Gyoyo in Japanese, which is used to treat the eye and eyelid disorders. Once you find it, massage it in a circular motion 10 times. The sixth point refers to the upper corner of the eyebrow. This acupuncture point is also known as SJ23 or Shichikuku in Japanese. It is beneficial for clearing your eyes and head and supporting the orbicularis oculi muscle to help in closing the eyes. To massage this point, use the circular motion and repeat it 10 times. The seventh acupuncture point is located on the lower eyelid, just on the inner edge of the lower orbital rim. You should be able to feel the depression at this point, which can be very sensitive. Press upwards towards the first point and massage the area 10 times. The eighth point. The acupuncture point ST2, also known as Shokyu in Japanese, is located at the eighth point in the middle of the lower orbital rim. This point has a small depression and the infraorbital artery branches help to supply the blood flow to the lower eyelid. Its function is to regulate and clear the eye circulations, which helps the redness, twitching, and support the closure of the eye. To stimulate this point, you can press against the orbital bone and rub it in the circular motion 10 times. The ninth point is located at the outer corner of your lower orbital rim. Press against the bone and move in the circular motion 10 times. And the tenth point is located just outside of the outer corner of your eye. You can identify it as a small depression, and it is also known as GB1 or Doshido in Japanese. This point is located near lateral palpebral ligament, which is the touch of the orbicularis oculi muscles that help to close your eyes. To activate this point, press against the bone and move your finger in circular motion 10 times. 11th point. The 11th point is located just below the 8th point. You may notice a small indentation known as infraorbital notch. This notch contains the infraorbital nerves, which helps to supply the inferior palpebral muscles that controls the movement of your lower eyelid. This point is also referred to as ST2 in traditional Chinese medicine. Bell's palsy patients typically experience tightness in this area, and you can massage this point in a circular motion 10 times to alleviate tightness. Point number 12 is located on your temporal area, approximately 2 inches away from the outer canthus. This extra acupuncture point is also Taiyan or Taiyo in Japanese, and it is where the first and second branches of the facial nerve known as the temporal and zygomatic branches are located. The facial nerve is responsible for controlling eye movement, eyebrows, and forehead. To stimulate this point, you can press against the bone and rub it in a circular motion 10 times. And repeat this whole cycle 2 more times. After you finish the whole cycle of eye massage for Bell's palsy, I want you to apply the heat directly to your face. You can use the warm towel or heat pack for about 20 minutes. The heat helps to increase the blood circulation, soften the tissue, reduce the inflammation, and soothe the pain. So it can be highly beneficial to perform this exercise every day, as it may accelerate your healing process and help you avoid being affected by permanent symptoms that can last up to 15%. As I mentioned earlier, Bell's palsy is a disease that can race against time. So the earlier you take care of it, the higher chance you recover quicker and faster. For a more proactive approach, you may want to consider alternative treatments such as acupuncture, which can help to speed up your natural healing ability. I hope you and your loved one will recover from Bell's palsy soon. Thank you for watching and see you in my next video. Take care. Bye.